Perfect. I have to say that, Bernadette is a longtime mentor and friend. And so I'm really excited. We share housing in common, even though we haven't yet collaborated. So this is a form of collaboration in the classroom. I'm really excited to share my work in this space. Just yesterday, I had a conversation with Bernadette and Professor Atua Heni, and she basically says, she asked me, like, what do you do, right? And, the short answer to that question, as a sociologist that works in the field of public health, is that I apply social science tools to public health, helping to kind of conceptualize in this case, housing as a social institution that has implications for health. So today I am going to be presenting on three different areas. My slide deck is packed. I will try to keep to 45 to 50 minutes, leaving enough time for engagement. I'll be talking about the 4 pillars of housing and how they're related to health, energy and security, what it is and why it matters to health. And because most of my work is really sad and in some ways, concerning, I always like to leave on a high note. And so I'll be talking about some housing innovations where I am in the Bronx. And so, yes, that's context that's important as well. I'm based in New York City. So just thinking about how do we think about housing, right? A lot of times for instance, in public health, there's been a lot of discussion about specific conditions like lead exposure or exposure to mold, for instance, that are linked to health. What I've been doing is to think about, well, what are the big buckets of housing that impact health? And that has really led me to these 4 C's that of cost, conditions, consistency, and context. The broad literature on neighborhood effects, for instance, which sits within the context bucket, has really explored how issues of concentrated poverty or safety, walkability, all of these factors have impacted health outcomes like obesity, for instance, asthma rates, based on air pollution, et cetera. But that's just kind of one area. That's the context in which housing is situated. But then looking kind of further into these dimensions of housing, the housing quality issues. So ideally, it's an environment that's hazard-free, that's healthy and safe, decent and sanitary. Then you have the housing affordability issue. That's where questions of rent burden, for instance, come up. And this is, or housing burden in general, but it's an economic ratio of income to housing expenditures. And ideally, it's somewhere in the 30% to 35% range. And then there are questions of housing instability or stability. And that is a mixed bag. On the one hand, more stability equals greater opportunities for people to have linkages to other social institutions like schools, social networks, healthcare provision, these other kind of links that happen when you have a long-term relationship within your neighborhood. However, there are some contexts where there's that tension between, let's say, housing affordability and housing quality, and residential stability. So as I think about public housing, for instance, it does offer the opportunity for housing stability, but many times the trade-off with that stability is housing quality, even as public housing is affordable to a household. So it's to say that there are tensions in all of these pillars, but that the pillars themselves also kind of lead us to understand something about health, and together we can understand what those tensions are and how people are making decisions and how those decisions ultimately lead to adverse health impacts. So, I mean, I'm sure that you all have been going over the origins of what we understand to be kind of more problematic housing. And just to kind of give it some context, this is really set up as policies and practices. Policies such as the displacement of Native Americans to reservations, right? Their forced removal and their isolation in the reservation context. Then there are kind of the urban renewal and subsidization of suburbanization, right? So essentially allowing for white flight to happen. There's redlining and public housing transformations, and then exclusionary zonings. And this is about a timeline that gives you a sense of where these policies kind of began and ultimately what we then see now as manifestations of a historical legacy in many ways of housing discrimination, really entrenched in these policies and practices. From a practice perspective, you have racial residential covenants, you have predatory lending that has happened, more recently gentrification, and like Professor Atuahene's work is really kind of getting us past this point to think about where municipalities, for instance, are also in practice creating adversities in the housing realm. But putting it all together, which is a big part of ultimately the real goal of my scholarship, is just to make connections and dots between seemingly disparate ways of understanding things, is to say that these kind of structures, right? So structural inequality in race and class and these exclusionary policies and practices, both historical and contemporary, lead to these kind of mechanisms by which these structures impact housing, and that we kind of describe as limited available housing stock, especially to some populations, the concentration of marginalized and unequal distribution of resources by neighborhood, right? The ability to distinguish between good and bad neighborhoods. Also the ability to develop financial resources through housing equity or to, for instance, gain personal wealth through housing. And then you have these housing pillars, right? The context, the conditions, the costs, and the consistency, all kind of coming together as mediators or moderators en route to health. And that's about differential vulnerability to chronic stress, just how hard it is for many people to actually contend with these housing issues. If any of you have lived through, a power outage, for instance, or the heat was cut off for whatever reason, or you understand that it's not just an encumbrance, but it's also a stressor. And for some people, there's no escape to that stress. It's also about the ability to acquire resources that promote health, right? We understand that health is a manifestation of physical activity and healthy eating and, being able to manage stress, for instance. But that becomes a lot harder if you're living in an environment that is unsafe, for instance, or that doesn't offer the possibility of healthy food access. Then you have differential vulnerability across the life course, meaning that even prenatally all the way through old age, if populations are even privileged enough to get to old age, that there are different ways in which we interact and engage with our built environment in such a way that obviously relates to health. And then there are these kind of health behaviors such as smoking and physical activity, which are all kind of driven by what people are contending with and what's available. So for instance, in New York City, we have the highest density of tobacco retailers happens to be near public housing. And so it's not surprising that many public housing residents, almost twice the number of the national average. So you have 1 in 3 households in public housing that report smoking, which is twice the amount of the national smoking prevalence rate, which is about 16%. So just to give some context about why that might even be the case, sometimes it's just about the availability of tobacco retailers. And these are some health outcomes, right? A lot of times, like I said earlier, in public health, they have focused primarily on respiratory health, right? Asthma as an important outcome. But if we think more comprehensively about what health is and how housing contributes to these health outcomes, then we have kind of a broader array of health outcomes by which we can understand that link between housing and health. And so I'm going to go through some examples of the 4 pillars of housing. I'll go through them relatively quickly because I have a lot of other content to cover, but I just want to kind of share through maps how exactly we might understand these issues. So this is a map of the United States, and it shows the poverty rate between 2012 and 2016. Of course, I'm here in New York City, but you see that there's really a wide distribution, right? So you have some of the lowest poverty rates in the middle of the United States, and then some of the highest poverty rates along the coasts and in the Southwest. And in the South especially, right? And then you also have the fraction of college graduates, and that is really also, in terms of a privilege, is really concentrated on the coast and in some areas, for instance, Colorado. Another way of thinking about context in this really broad way is incarceration rate for children of low-income parents, right? And there again, you see that there's kind of an overlap between poverty and this form of disadvantage, which has to do with mass incarceration and who's impacted by mass incarceration. Now, I'm here in New York City, and so a lot of the data that I share and I will share today is based in New York City, but just to give you also some context, I'm based here in the Bronx. So this is the Bronx, this is Manhattan, Queens, Brooklyn, Staten Island. And what you see is that in the dark blue, you have the highest poverty rates in New York City are really concentrated. They're concentrated in the Bronx, but they're also concentrated in some of these lower income areas of Brooklyn and Queens. In terms of college degrees, there's an inverse relationship between poverty and college access. And, again, you have the Bronx, it's light blue because there are far fewer people in comparison to parts of Manhattan and the wealthier parts of Brooklyn and Queens. And then incarceration, same thing, right? So you have, along with poverty, you have higher concentrations of incarceration in Upper Manhattan, in the Bronx, and in those same parts of Brooklyn and Queens. And, essentially the point that I'm trying to stress here is the importance of not just context and disadvantage in these kind of specific areas, but the fact that they are so concentrated and affecting the same populations. So again, let's think about, so this is the conditions pillar. So you have housing conditions in the US, lower income households are more likely than their more privileged counterparts to live in housing with heating and electrical problems, to have experienced multiple heating equipment breakdowns, to have experienced an interruption in utility services, have inadequate insulation and insufficient heating capacity, and report being uncomfortably cold for 24 hours or more. So these are some of the kind of energy related indicators that really suggest that lower income households are more disadvantaged. And I did not mention this, but I guess it's not that surprising that there is this kind of connection between low income status and racial and ethnic minoritized communities that are most impacted by what we know as health disparities. So, kind of adverse health outcomes in this population. So bringing you back to New York City, homes without maintenance defects, meaning that these are folks that actually have access to healthy housing. That is most available in parts of Staten Island, in parts of Queens, in parts of Manhattan. least available in those same areas, right? So you have the Bronx, Upper Manhattan, and these poorer pockets of Brooklyn, poor and older pockets of Brooklyn that don't have access to healthy housing. From an air conditioning perspective, right, many of us have the benefit of air conditioning wherever we are. That has a lot to do, you know, with not just comfort, but thermal regulation. And in some ways, it's a matter of life and death. And what you see here is that, you know, in Manhattan, you have almost perfect penetration rate of air conditioning. But in the Bronx and in parts of Brooklyn, you have the least penetration. In public housing, for instance, only 1 in 2 households actually have access to air conditioning, which means that, you know, when there's extreme heat, they're also the most likely to suffer from heat-related illness and also, unfortunately, to die. And Kleinenberg's work, Heat Wave, that was originally based on the 1995 heat wave, really talks about social cohesion and all of these dimensions of connectedness and social isolation. But if you think about it in really practical terms, a lot of what was happening in that story and what we see unfold every summer as heat kind of, you know, basically this was the hottest summer on record. The last few summers have also been the hottest summers on record. So you have the climate effects kind of happening. But from a very technical perspective, a lot of what's going on is that there are many households, you know, poorer households, especially that don't have the ability to thermal regulate as a result of having access to air conditioning. And the heat complaints are similar. So, you know, obviously these are seasonal issues. In New York City, we have both warm summers and cold winters. And what's really obvious, and this is not mapped, but it's graphed, is the fact that in the Bronx, they have the most no heat complaints season after season, meaning that not only are households in the Bronx unable to seek comfort in the summertime, but also in the wintertime, a lot of times when it has more to do with the landlord, for instance, that is supposed to provide heat in the context of the rent, they're also unable to access this comfort in the winter season. And this is another way of seeing it, but essentially there are so many communities, those same overlapping communities where the Bronx is essentially freezing, which is a distinction between how it was understood to be in the 70s when they were saying that the Bronx was burning due to you know, kind of, I guess, mass burnings and not only disinvestment, but surely you know, issues around vandalism and using fires as a tool for getting out of, you know, a property, which I'm not going to get into, but was a manifestation of our historical footprint. So this is another kind of way of thinking about, so this is the third pillar around cost. And again, being in one of the kind of most expensive areas to live, not just in the United States, but in the world here in New York City, you realize that too, you know, along with some of the privileges, come the burden of housing costs. In the, you know, middle of the United States, you know, people can spend as little as $400 on average on rent, but, you know, that increases significantly depending on where you are. Here in New York City, again, another picture, a bleak one, around rent burden and the same populations impacted by a high rent expenditure to income ratio here in the Bronx and other high poverty areas. And the last pillar is that of consistency. So Urban Institute has really, you know, kind of started to think about what are these aspects of residential instability, right? So you have kind of contributors to residential instability. So some of that is about kind of neighborhood dynamics, you know, what plans are made for a neighborhood, how that might attract especially higher income residents, for instance. You have housing unit conditions, right? So people often leave their units when the housing conditions are untenable. You have household characteristics. So, people's families may grow. They may, they may have smaller families. Something about the household characteristics may change, including employment status or wages, for instance. And then you have these kind of metropolitan area and housing market dynamics. Essentially, these are all contributors to what would make a residential situation kind of unstable. But with that come these losses, the losses in educational continuity, in social and political capital, in health and access to healthcare providers, financial security, safety, and crime. So households below the federal poverty level, moved at nearly twice the rate of non-poor households during a 1-year period, 19 versus 10%, really kind of showing the connection between poverty and mobility. And evictions are really kind of the most egregious example of an involuntary move. This data is from the Eviction Lab, Matt Desmond's work. And it ends around 2015. But basically, this is the red line is evictions, and then the eviction filings. And what you see is that many people actually leave in anticipation of an eviction, right? So they actually haven't necessarily been evicted, but they're en route to eviction, and that is what triggers the mobility. And what you see also in looking at the map of the United States is that there's also a high correlation between evictions and racial disparities. So that African Americans are really disadvantaged when it comes to these involuntary moves and forced displacement. In New York City, they've actually, so this is again, a bleak picture of of where these evictions are happening. And again, this kind of disproportionality in where the Bronx is in terms of evictions. I have to say that that it's improved, but COVID-19 clearly is now, kind of a new trigger for evictions, and there's an expectation that mass evictions will occur in New York City and really throughout the United States, as well as foreclosures, which we've already experienced in the last recession. I guess another important point is that between 2018 and where we are now, they actually set up a bunch of protections for tenants here in New York City, and one being access to legal services. And that was an important contribution to reducing the number of evictions in New York City by allowing folks to actually have access to a lawyer in housing court. That had never been done before, but it's proven to be quite effective. But we know that, when landlords have just cause, they go for it, and households are negatively impacted. All right, so those were the 4 pillars of housing: cost, conditions, consistency, and context. Now we'll talk about energy insecurity. This is an area that I have personally been very active in leading the field and raising awareness about how household energy is a thing. And not just a thing, but also a factor that impacts health. And I like to start this, when I talk about energy insecurity, for me, it's very personal in the sense that it affects people in ways that we can relate to, and yet, is kind of what I like to call it is like, hidden in plain sight. And so 2 years ago, there was a woman named Linda Daniels, who's a New Jersey resident. And it was the summer months. The temperature was just below 95 degrees. So just to give some context, in New Jersey, the utilities are unable to cut someone's utility services off if they have a medical condition, and also when the outside temperature is 95 degrees or higher in the summertime. But Linda Daniels was caught, kind of on a 90-degree day in this really complex web of administrative lapses. She was reliant on an oxygen machine, an oxygen concentrator to give her breath. But she had overdue bills, and for whatever reason, her family and her medical providers were unable to enlist her in the medical protection. And so her family had tried to put together as much money as possible to avoid a shut off, but it was too late, and they did shut her off, and within hours she passed away. And just the headline alone basically suggests that it's totally preventable, because it was. At some point, this was really an oversight, and I mean, an egregious one at that, that really cost her life. One of the things that I like to bring to this scholarship is an understanding that energy is really essential to so many of the things that we do on a daily basis, from refrigeration to lighting to heating and cooling, and the use of medical and technological devices. Like, all of these things are important to our everyday life, and even more so as more of our life is plugged in. This is Maslow's hierarchy of needs. And if you think about where energy is, it's really a base issue, right? It's kind of in some ways subsumed under warmth, but we could talk about it as connectivity and so many other things in the context of our daily lives now. The World Health Organization, which has gotten a lot of attention in the COVID context, has also been an important voice in raising awareness about how energy is so essential to life. And then they also kind of acknowledged back in 2006 that this has been ignored by the world community. Their reference, though, was really about the developing world, and how we lack energy infrastructure in an equitable way around the world. But this is also a domestic issue. And so how do we understand these issues? So food insecurity, most people understand it to be, an inability to kind of adequately meet their food and nutritional needs. Energy insecurity is a parallel concept, and it's the inability to adequately meet basic household energy needs. And it has 3 dimensions. So it's high bills and low income, which is an economic dimension. There's the physical dimension that has to do with the reliability and the efficiency of the energy infrastructure in a home. So your heating and cooling systems are an example. Whether or not there have been electrical upgrades, for instance. And then also behavioral. So what are the coping strategies that people use in order to meet their household energy needs? And I'll just kind of briefly go over what is known about energy insecurity in the United States. We know that it affects 1 in 3 households. By comparison, food insecurity affects about 17% of the US population. Energy insecurity actually affects 1/3 of the US population, but has gotten far less attention. We know that low income is a main driver of energy insecurity, that there are persistent disparities by race, ethnicity, and immigration status, that children, seniors, and the medically vulnerable are at greatest risk, that renters and owners are differently burdened. Energy inefficiencies contribute to higher costs, decreased comfort, and adverse health consequences, that there are geographic and spatial disparities at the regional and metro level, as I had been kind of showing with the AC penetration rate, and also no heat complaints, that it involves complex coping strategies. These adversities in terms of health, social, economic, and environmental consequences, that health is both a predictor and an outcome. Like Linda Daniels' case, right? She was medically vulnerable, but we can also understand health to be an outcome of energy insecurity. that energy insecurity actually has been used to advance energy justice. So this idea of creating opportunities for people to not just participate in a new and clean energy economy, but that they also have their basic needs met as a manifestation of justice, and that policy solutions that already exist, like energy assistance programs and weatherization assistance programs, should be preserved and enhanced. So just to give you a sense of the prevalence of energy insecurity in the United States, back in 2015, the U.S. Energy Information Administration administers the Residential Energy Consumption Survey every 4 years, thereabouts. And what they found, they kind of used the conceptualization that I've offered in some of my work in the past to essentially ask households, a representative sample of households in the United States about these energy insecurity situations. And what they found is, again, that 1 in 3 households in the United States comes from this figure. So that's any household energy insecurity, but also these specific scenarios like reducing or foregoing basic necessities to pay energy bills, receiving a disconnection notice, or keeping homes at an unhealthy temperature. And so you see that this foregoing basic needs like food and medicine, that trade-off happens more often than keeping a home at an unhealthy temperature. But speaking of time, this is also happening for some families almost every month. And then for other households, it's only happening conditionally or occasionally. But this is an important issue because it basically means that you have chronic energy insecurity for some households and conditional energy insecurity for other households. That may be triggered by seasonality. It might also be triggered by other kind of issues that are happening at the household level, like changes in wages, for instance. But what we also know is that energy insecurity is patterned by vulnerability. So low-income households, households with children, older homes, African Americans and Latinos are more likely to be energy insecure. The elderly, for instance, are actually less likely to be energy insecure than younger folks, but they get a lot of attention because of their vulnerability status, which makes a lot of sense. So kind of thinking about
all of the programs for the elderly.
So, I mean, I'll just give you an example. In Europe, they actually provide a tax benefit, like an abatement, only for those that are older, not based on income or kind of other like medical vulnerability, for instance. In the United States, it hasn't been that way, but there's more participation among the elderly in programs like the Home Energy Assistance Program than there are for households with children. So even though, you know, households with children actually have the highest, some of the highest prevalence of energy insecurity. So, you know, basically, I'm not going to go through this whole pathway, but what it does show is that it leads to, you know, real adverse health consequences, or the ones that like take you en route to those adverse consequences. So these environmental, health, social, but also the economic pieces, which might lead to foreclosure or to eviction kind of later on as well. I'm going to talk about disconnections, because disconnections are essentially the equivalent of evictions when it comes to utilities. It's a crisis point, right? It is that kind of point of not having access to the service, and shutoffs happen primarily from non-payment. And utility companies have increasingly used disconnections as a way of recovering costs for the provision of services. So here, remember I was talking about these chronic energy insecurity scenarios where people are dealing with this almost every month versus those kind of conditional qualities. And so chronic disconnection notice are those households that are receiving disconnection notices almost every month, and then conditionally it's just some months out of the year. And what you see is that households with children, so the kind of blue side of the bar, suggests that 1 in 2, over half of households with children are actually experiencing chronic or conditional disconnections. in comparison to the elderly or households with just adults, which in my mind, are this kind of underappreciated group of vulnerable populations because they can't anchor their vulnerability on like age or where they are in the life course. So it's just something that, kind of interesting to think about. So these are just the disconnection notices. We'll get into disconnection. So we found that almost 3% of the population has experienced a disconnection at some point in the last 12 months in 2015. And that African Americans, low income, those with less than a high school diploma, people living in mobile homes, reporting inadequate insulation, people living in older homes, renters, those living in rural areas, and also living in the Northeast are more likely to have been disconnected, right? So those are the correlates of disconnections. But what are people doing, right? That coping aspect. So there are the trade-offs. So if you've experienced a disconnection, you're much more likely to actually be trading off between food and medicine, for instance, as a result of that disconnection. You're also more likely to keep your home at an unhealthy temperature than those receiving a notice only or no notice or disconnection. And also, you would think that would come with, with seeking assistance, seeking and receiving assistance, but it's actually far less the number of households that are seeking assistance, even though it's more than those that just receive a notice or a disconnection or nothing at all. But in comparison to those that are taking matters into their own hands, for instance, by foregoing meals or medicine, it's far less. All right, I'm gonna take the next 5 to 10 minutes to talk about more hopeful things, and then we can engage. So get your questions ready if you have. So a big part. I do work a lot of work in public housing, actually, not just in New York City, but also in other parts of the United States. And some of you may be familiar with RAD, which is the Rental Assistance Demonstration. It is an attempt to reintroduce capital improvements in public housing to address the capital backlog, which is about $30 billion nationally, in part because public housing just has not received the attention that it deserves, and certainly the investment that it deserves. So thinking about what housing subsidies do, I mentioned this a little bit before, but they offer the opportunity for residential stability. They can invite the possibility for a better physical environment, although that has not been the case because of these capital backlogs. They can offer the opportunity for linkages to services and amenities, safety and social capital through kind of networks. It offers that possibility of housing choice, especially when you think about vouchers, although it also introduces the reality of interacting with discriminatory practices. But fundamentally, this is an income supplement, right? It allows low-income people to be able to afford other aspects of their lives because they have this kind of income supplement in housing, in a housing subsidy. So the rental assistance demonstration was really introduced in the Obama era, and it serves as this opportunity for housing authorities to assemble a mix of public and private resources, including mortgages and low-income housing tax credits to preserve and repair distressed public housing. It essentially is an administrative shift, moving away from Section 9, which is public housing, to Section 8, which is a housing subsidy. Means very little in terms of the recipients of this housing subsidy, but means a lot in terms of administering the housing units themselves. It improves upon other demonstrations like the MTO and Hope 6 in that it allows residents to remain in place, but in a better unit. So we looked at Fresno. That was the first housing authority to fully undergo the RAD conversion process. These were the elements of their process. They're not all the same, but important to kind of think about how it works. So there's the planning component, the conversion component through the low-income housing tax credit. There's the temporary relocation where residents are placed somewhere else. There's the rehabilitation and construction of community centers. So really introducing the idea of services and amenities within the housing complex. And then a return to a renovated unit, and then being able to experience and enjoy these amenities and services. Now, what we found in evaluating the impact of RAD in Fresno is that it fell within these kind of themes. So heating and cooling system and appliance upgrades, unit layout and aesthetics, safety and connectedness, and then resident resources and pride of place. And these are all really important because if you can just look, and I'm not going to read through them, but if you can just kind of see where the pre-RAD and the post-RAD realities are, there were significant improvements in what people had access to and how they experienced their housing. I like to kind of focus a lot on the bottom two, in part because there are longstanding issues and things that are much more difficult to correct for, even with an infusion of capital. So safety and connectedness remained issues even after these improvements. But a lot of parents especially noted that they had increased pride in their living spaces, and they felt that these improvements had positive implications for their children. And they felt invested in. So they went, from feeling shame and stigma to feeling invested in, which were important transitions. From an educational perspective, we found that those that were living in RAD had less chronic absenteeism, and they actually had better overall GPAs. This is for children in grade school. I've been looking at the RAD conversion, the second RAD conversion here in the Bronx in New York City. And this is what the before pictures look like. A lot of mold, a lot of housing conditions in common areas and in apartments. This kind of, these representations of health or ill health that we saw kind of on a regular basis. But what was interesting about the RAD iteration here in the Bronx is that it was combined with these community conversations and these opportunities for people to come together around healthy food, and also around, the idea of community building. And that was happening in units with families, as you can see here with the young kids, but also in senior housing, which is also important from a social isolation perspective and getting people to be, coming together. And so, that's the investment in amenities and services. In this case, it was in combination with Catholic Charities, who had hired a community organizer to kind of reestablish that fabric, that social fabric in the buildings. Bernadette knows this about me, but I always think it's important for me to situate myself in this work. And so I not only, I've mentioned so much the Bronx so that's not a surprise, but I also grew up in Section 8 housing. This is the building that I grew up in near Yankee Stadium in the Bronx. This is me in Head Start, and this is me at my fourth grade graduation, all of 9 years old. It was also a time when Jonathan Kozol had written this book. This is literally 1995, called Amazing Grace. And it was about kids in the South Bronx, in my neighborhood, in fact, in Diego Beekman houses where my grandmother had lived for almost 40 years. And that reading that book in college was the impetus for my becoming a scholar of housing and a scholar of neighborhoods, in part because I felt like I wanted to write my own story. I was really frustrated that this journalist from Massachusetts was writing about my community, and it was extremely frustrating to think that he could helicopter in, tell this story, and leave. And so I wanted to be a voice for this scholarship. My mother ended up buying a home that was part of the rebuilding process in the Bronx. It was a condo. She still owns it. It was an opportunity to basically go from Section 8 to home ownership, moving to Opportunity Story, but very personal and very different, rooted in advocacy at the community level. This was me in college. I guess around the same time, maybe right after, not shortly thereafter, I met Bernadette. And then I went to Cornell, which was like a big culture shock. But it was actually what gave me the opportunity to leave. And then the vision to come back. And it was, really about thinking, well, how does housing in place? And, one of the things that happened to me when I was studying at Cornell was that I realized, oh my God, these buildings are so important. They're so big and they feel so like far removed from how I had grown up and, the ways in which I understood place and space and belonging. They were, the buildings that were old and well kept. And they felt like they were not meant for a little brown girl like me. And so what I started to think about was, basically that where you live is political and it's consequential, particularly if you have choice. And I wanted to come back to my community and revitalize from within, really combating these kind of domestic and inner city brain drain problems, and also deconcentrating poverty. But again, doing so from within. And so in the past few years, I have purchased several of these little buildings. I own these two actually to date. We've added solar. This is my business partner and mother. And, this has been, like a real kind of testament to sweat equity, but also to building equity in the South Bronx. And so for me, the real takeaway in all of this work, so the work in conceptualizing the pillars of housing and really kind of honing in on household energy as a determinant of health and as a hardship in and of itself, and, kind of evaluating the impact of various housing interventions and doing some of those interventions on my own has really been about kind of thinking differently about equity and housing and health. And, kind of following a vision or re-envisioning what housing can mean from a people, place, and policy perspective. So health equity in housing, can be and would entail opportunities for all individuals, regardless of race, ethnicity, socioeconomic status, household composition, or zip code, to benefit from developments in modern building science, fair maintenance practices, community planning, and creative uses of space through programming to foster a culture of health and social connections. And that vision would basically be kind of informed by economic security, housing affordability, energy efficiency and weatherization, and energy literacy, really in the hopes of, thinking through, these are participants that I've come across in my work. So a lot of money should go into agencies for people like myself who have a high gas bill, or people who, have high electricity bills, and really kind of fulfilling the promise that one of my participants said, which is, my outlook is on this, on it, is that I want better for my children, and to have better for my children, I need better housing. And to me, that is a charge for all of us, but it's a charge that I have taken on